Imagine if every time your life began to change, so did your brain. For many women, the transition into menopause is not just a physical shift, but a cognitive upheaval. Among these women, those with attention deficit hyperactivity disorder, ADHD, face a doubly challenging wave of symptoms that blend and blur into each other, creating a storm of confusion and distress. This essay delves into the intricate dance between ADHD and menopause, revealing the unique struggles that come with managing ADHD symptoms during the hormonal roller coaster of perimenopause and menopause. ADHD often presents differently in women than in men, typically with less overt hyperactivity and more internalized symptoms such as inattentiveness and emotional dysregulation. These symptoms can be easily misunderstood or dismissed by those unfamiliar with the gender-specific manifestations of ADHD. Women with ADHD may spend years managing their symptoms without a formal diagnosis, adapting to societal expectations in ways that can mask their struggles. Many women only receive an ADHD diagnosis after observing symptoms in their children, which speaks volumes about the persistent gender biases in diagnosing this disorder. This delayed recognition can lead to significant emotional and psychological repercussions, which may be compounded by the onset of menopause. Menopause is not simply about the cessation of menstruation. It involves significant changes in the levels of hormones such as estrogen and progesterone. These hormones are not only pivotal to reproductive health, but also play crucial roles in cognitive function and mood regulation. As these levels decrease, women often report increased instances of mood swings, memory lapses, and a general decrease in cognitive function, symptoms that strikingly overlap with those of ADHD. Understanding these hormonal shifts is crucial for distinguishing between menopausal symptoms and exacerbated ADHD symptoms, a task that can be daunting but is essential for effective management of both conditions. During menopause, many women with ADHD notice a significant increase in their symptoms. Common issues such as distractibility, forgetfulness, and emotional sensitivity become more pronounced, often exacerbated by sleep disturbances and physical changes like hot flashes. This synergy of symptoms can lead to significant distress and affect a woman's quality of life, making it imperative to understand the specific interactions between ADHD and menopausal changes. For instance, the decrease in estrogen during menopause can affect the brain's dopamine levels, which are already dysregulated in individuals with ADHD. This can lead to an increase in the core symptoms of ADHD, making everyday tasks more challenging. Diagnosing ADHD in menopausal women presents unique challenges. The overlap of symptoms can lead to misdiagnoses, with ADHD symptoms being attributed solely to menopause. This misattribution can prevent women from receiving the targeted interventions that are crucial for managing ADHD. Moreover, the stigma surrounding both ADHD and menopause can lead to a reluctance in seeking help, further complicating the diagnostic process. Medical practitioners need to be equipped with the knowledge and tools to differentiate between the two conditions, ensuring that women receive accurate diagnoses and appropriate care. ADHD medications, such as stimulants, can have different effects on women who are undergoing menopausal changes. While these medications are designed to enhance focus and reduce impulsivity by increasing dopamine levels in the brain, their effectiveness can be impacted by hormonal fluctuations. Some women may find that their usual dosages are less effective or cause more side effects during menopause. There is also some evidence suggesting that ADHD medications might alleviate certain menopausal symptoms, particularly those related to cognitive decline. However, more research is needed to understand the potential benefits and risks fully. Hormone replacement therapy, or HRT, is often prescribed to alleviate menopausal symptoms, but its impact on ADHD is less clear. Some experts believe that stabilizing hormone levels could potentially ease ADHD symptoms by improving overall cognitive function and mood stability. However, HRT is not suitable for everyone and comes with its own set of risks and benefits. It is crucial for women with ADHD to discuss these options with their healthcare providers, considering both their menopausal and ADHD symptoms to make informed decisions about their treatment. Life Impacts, Personal Accounts. Personal stories from women who navigate both ADHD and menopause highlight the profound impact these conditions can have on their lives. Many report a significant deterioration in their quality of life during menopause, with increases in ADHD symptoms leading to challenges in personal and professional relationships, as well as overall well-being. These accounts underline the need for better support systems and more tailored treatment options that consider the complex interplay between ADHD and menopause. They also serve as a powerful reminder of the individual faces behind the clinical discussions, driving home the urgent need for focused research and intervention. Research gaps and future directions. Despite the clear need, there is a striking lack of research focusing on ADHD and menopause. This gap leaves many women without the evidence-based guidance necessary to manage their conditions effectively. Future research should look into how hormonal therapies can be optimized for women with ADHD, the long-term effects of ADHD medications during menopause, and the best strategies for diagnosing and treating ADHD in the context of menopause. Such studies are essential not only for improving individual outcomes, but also for informing policy and healthcare practices that can transform the lives of countless women. Expert opinions. Experts in both ADHD and menopause stress the importance of recognizing the link between these conditions. They advocate for integrated treatment approaches that address both hormonal and neurological aspects. By doing so, healthcare providers can offer more comprehensive and effective care. Recommendations from these experts often include multidisciplinary teams involving gynecologists, psychiatrists, and psychologists, all working together to provide a holistic treatment plan that addresses all aspects of a woman's health during this challenging time. The societal and medical recognition of the challenges faced by women with ADHD during menopause is still inadequate. This lack of recognition can lead to underdiagnosis, misdiagnosis, and inappropriate treatment, exacerbating the difficulties these women face. Advocacy for greater awareness and understanding is crucial. It involves educating both the public and medical professionals about the nuances of ADHD in women and the specific challenges posed by menopause. Fortunately, there are resources available for women dealing with ADHD and menopause. Organizations like Attitude provide valuable information, support groups, and tools designed to help women navigate these complex conditions. Additionally, books, webinars, and online forums offer spaces for sharing experiences and advice, helping women feel less isolated in their struggles. Accessing these resources can provide significant relief and practical support, helping women to manage both ADHD and menopause more effectively. This essay serves as a call to action for researchers, healthcare providers, and policymakers to pay closer attention to the intersection of ADHD and menopause. By fostering a deeper understanding and developing targeted treatments, we can improve the lives of countless women facing these intertwined challenges. Readers are encouraged to advocate for themselves and others, pushing for more research and better care practices that recognize and address the unique needs of women at this stage of life. The conversation about ADHD and menopause is not just about medical symptoms. It's about acknowledging and addressing a significant yet overlooked aspect of women's health. As we advance in our understanding and treatment of these conditions, we must keep the voices of affected women at the forefront, ensuring that they receive the comprehensive care and support they deserve. Through dedicated research and compassionate healthcare, we can hope to turn the tide for women battling the dual challenges of ADHD and menopause.